Hi and welcome back. This is video number 3, and today we're going to talk about pain. Now, it's likely that you've got shoulder pain, and pain is a big part of your shoulder dysfunction that you're experiencing right now. So the big thing we want to sort of get to know about pain is that pain has a huge effect on the brain, and the brain really is the driver of whether you feel pain or not. Your brain is there to protect you and to warn you of potential tissue damage. It's also there to protect you when you do actually have tissue damage. But pain doesn't always mean that you've got tissue damage or pathology. Okay, as an example, you can get a paper cut, a smallest amount of tissue damage, and yet feel excruciating pain. On the other hand, a surfer that has his leg or her leg bitten off by a shark at the time feels nothing. Don't feel anything until you reach the beach and someone's trying to really save you, and then they start kicking and screaming. Okay, so it's really interesting that pain is mediated and controlled in the brain. Your brain will only get you to feel pain if it thinks you're in trouble, or if it wants you to act or protect a particularly painful joint, say for example like the shoulder. Okay, so it's really important to understand. The big things that you want to understand about your shoulder, we want to keep this as simple as possible, is that pain inhibits, okay, there's inhibition. It's going to inhibit all those vital muscles that lie around the shoulder blade and also the rotator cuff muscles which come up and attach to keep your shoulder stable. So once these muscles are inhibited, they're very tricky to get back, because what will happen is your brain is now going to change the way that you think about your shoulder. So you're going to start to protect it more. Potentially some people start to use the opposite arm straight away. They put the damaged wing into a sling position, or they put it into their pocket, and they forget about it. They don't use it. They start to answer the phone with the other hand. They start to type with the other hand. They might put that hand out to shake someone's hand when they meet them. So it's really interesting. Your brain is going to change the way you think about the use of your arm. It's also going to change the way you move, the way that your brain plans movement. It's going to change the way that you move, and it'll change the muscle patterning of how you use that arm so that you can either continue to use it or you can use it while you're still protecting it. So some of these weird things start to happen, and usually you're not even aware of it. The other thing that your brain can actually influence when it's still registering pain and you still feel pain is that it's going to inhibit your progress. You're not going to be able to move forward in terms of getting your shoulder pain sorted out if you can't get your pain under control. Okay, and we do that using a number of different strategies. Certainly we use the physiotherapy type strategy. We can use pain medication if it's appropriate. We've got all these strategies to start to get your brain to start to remodel itself almost, so that now we get a new way of moving. We get progression, so we start to get on top of your pain, and we change the way you think about your shoulder. You're going to start to feel more confident about it, because there's less clicking, there's more power, there's more movement, and your confidence starts to grow, certainly as your shoulder function improves, but also really powerfully as your pain starts to drop down. So getting this pain under control is really important. It's a huge concept, and it can be done fairly simply. In the next video I'm going to tell you how to take action. Some of the things you need to do right now. If you're not paying attention to your pain, you've got to get that down, and I'll talk to you about a few strategies you can start to use right now in terms of getting your pain under control, because it inhibits the vital muscles you need to move forward, and we know that pain starts to make changes in your brain. The more that you have a dysfunctional shoulder, the more that you don't use it properly because of pain, your brain is now going to start to remodel itself, and it's going to make you move differently, and certainly going to start to think differently about your shoulder. Lastly, pain doesn't always equal pathology. It certainly does in most cases. You go out and injure yourself, the tendons swell, you've now got tendonitis, yeah, you're going to register pain, but it doesn't always fit that pattern. So that's just an interesting fact that might pay you some value down the track. Okay, enjoyed bringing this to you. I look forward to seeing you in the next video where we talk about taking action.